Today I'm going to be treating a patient with a right ACL post-operatively. Today we're going to be putting on some biphasic pulse current. This type of treatment is good for some neuromuscular re-education to get the quadriceps to fire and contract forcefully to help prevent some atrophy of the muscles. So today we're going to be setting up our machine. But first, before we do that, some contraindications for this treatment are going to be if the patient has a pacemaker, active cancers, pregnancy, impaired mentation, or impaired sensation. So, starting over here on our machine, we're going to put it on setting, biphasic setting. We're going to make sure our time, frequency, and rate and width are all where we'd like. So 200 is going to be our pulse width, and the rate is going to be 50 pulses per second. And for time, we're going to go 10 contractions per minute with a duty cycle here of 10 and 50, and we'll have a ramp up time of 1.5 seconds so the patient isn't jarred and surprised with a really shocking experience. So, first of all, coming over to the patient, I'll go ahead and check their skin, make sure it looks okay. And place the pads.
I like that right anyway. Next time, yeah. Do it on my right leg this time.
Alright. Now, Kate, when we go ahead and get started here.
That class back, I think that's not that bad. The second one.
Do you have a pacemaker?
No, I don't.
Okay. Any active pregnancies?
No,
Active cancer?
not that I know of.
Okay. Do you know where you are today?
I think I'm at Rocky Mountain University.
Good. And then you could feel all of this, correct?
Yep.
Okay. Alrighty, now as I turn this up, Kate, we want this to be a strong but comfortable contraction. We want it to be as much as you can tolerate, essentially. So it should be uncomfortable but tolerable. I don't want you screaming in agony.
Okay.
Okay, so I'm going to go ahead and start turn this up. You tell me when.
Sensation.
That's a resume booster.
That's pretty strong.
Good there?
Yeah.
Okay. So I want you to squeeze and contract forcefully with that stimulation there. So it's going to be a strong forceful contraction for 10 seconds, and then you'll have 50 seconds of rest. So the reason for that is we don't want you to fatigue too quickly, and we're just going to get 10 solid reps to start, and then we may increase that as we move forward with your treatments.
Okay.
Now she's very
Okay, the second rep here is going to be starting soon. So big squeeze.
I'm gonna make them do it here.
So after those 2 repetitions, we're going to go ahead and stop the machine. Does that feel okay, Kate?
Yeah.
Ready. I'll take these electrodes off, make sure we don't have any tissue damage, any redness or possible burns. Tissue looks good. All set today.
You do high rate or low rate?